What is one thing you wish every pregnant woman knew before going into labor?
Yes. So I would say, if I could speak to every pregnant woman, that it is going to be hard, but when you rehearse the strategies, they will serve you in moments of despair.
Got it.
Does that make sense?
Yes.
Okay.
I feel like what I heard is it can be painful, but it doesn't have to include suffering. Like suffering
Right.
is like prolonged pain. Like it can be, for some women it may not be. That,
Yeah.
you know, like it's not a one size fits all. But you preparing them to be able to rehearse
Yes.
that moment, it also gives you kind of sovereignty over your body and like
Absolutely.
at least some sense of control.
Yeah.
For whatever
absolutely.
that means.
I mean, there's a lot of aspects of your birth experience that you can control, right? Like where you are, who's in the room, what position you put your body into, if you're choosing to do your breathing strategies or just letting the sensations carry you away. There are quite a few components that we can control. And then even just leading up to that, you can determine without a doubt if I am going to have a lot of muscle mass on my body, or if I'm going to be weaker, or if I'm going to have flexible hips, or if I'm going to allow myself to be tight. So all those components you can manipulate up until the actual event, right?
I feel like the sad part is that not a lot of women know that they have those options.
Right, right. Or to even connect the dots of like the depth of understanding of how important it is to have flexible hips before you go into labor, or to have a connection to your pelvic floor before you go into labor.
Awesome. The next question I have is, after having a C-section, can I
Yes.
still have a vaginal birth?
Oh, that's a great question. Yes. So the answer is yes, you can. It's considered a VBAC, vaginal birth after C-section. The physician would need to be in support of that. So specifically in the state of Florida, which is where I practice, so I'm familiar with those laws, that you would want to have a conversation with your physician ahead of time, and it would be determined based on the reason you had the C-section in the first place.
Okay.
So that category of decision is not within the physical therapy realm, but having been in this world of obstetrics, I know that typically if the woman had a C-section because the labor didn't progress or the baby wasn't in a great position, then there could be potential to have a vaginal birth because maybe this baby will be in a different position. But if there's a medical reason or an issue with the cervix, then sometimes they will say the reason remains and a vaginal delivery would not be recommended.
Got it. Awesome.